Madame Christine here. She's a nice lady, but she has fine wrinkles on the upper lip and some skin that we can improve with the technique that I showed you before. I should use the Theo pen with the RHA1. She had only a cream on the face, nothing more. Here it goes, please. Anesthetic cream because the area is really painful. So it's always better to do a mild anesthesia. Okay. She has dynamic wrinkle, you see, but she has also static. Okay, it's okay. Static wrinkle. So I will try to inject static. The speed is low, is the green one. Only a few drops. RHA1 is very fluid, so we can press and we do not have the risk of hypercorrection or over-treatment.
Just one question. Which needle do you use for this?
I'm using 30 gauge needle, but with the Theo pen, we can also use needles that are smaller, like 32 or 33, because there is a mechanical piston inside that push, so we do not have the problem of moving the hands or forcing on the piston. It's very easy to inject.
Are you intradermally or are you just in the subcutaneous layer?
I try to be intradermal or very superficial, but as you know, the dermis is very thin, 0.4, 0.6 micron, so I am sure to be there, of course. And I try to be superficial, that's it. I don't care about my layer. Can you move your...
Giuseppe, may I ask you, you inject now from below. Do you consider to inject also from above? If you inject from above, is it not less painful than from coming from the lip contour line?
It's not less painful. It's exactly the same. I can inject from below or from the higher part. It's the same. It's only... If I inject from the higher part, it's probably I can correct also vermilion border. If I inject from below, it's more difficult.
How much do you inject in each line?
More or less 0.1, 0.2. I have now injected in total 0.4, 0.3. So really a small quantity for each line. I keep the lip between my fingers of my left hand because I want to identify the wrinkle, and I tear the wrinkle on the contralateral side.
Do you use sometimes a combined technique where you treat first, for example, this woman with botulinum toxin, and in the second time you will do HA?
Yes, we can, and I do sometimes. I should not use in this patient because she has a very fine wrinkle, very static fine wrinkle. If I should use the botulinum toxin, can you contract? I use only 2 units here and maybe here, no more.
How frequently do you contour the lip line, the vermilion border together with this?
It depends on the attitude of the patient. If they non-smoke, if they are normal, we can say about 6-8 months is enough. If they take a lot of sun and if they smoke, maybe something less, but not so much less. 6 months minimum. While she contract, I do some more injection to fill the dynamic barcode. I inject in total 0.6 now.
Giuseppe,
yes, please.
How important is the pen for you? Because I see the pen in my clinic being much more efficient. What is your highlights of the pen you work with since?
Of course, I was born as the most part of us with the syringe. So when I get the pen, I was a little bit astonished. But nowadays I use the pen for 90% of my patients, and they ask me for the pen. Doctor, you don't have the pen today, is the normal phrase I hear. They ask me the pen. So I think the pen is something that we really have to have. We really must have on our table. We do a random injections. The first one is here because there is an acupuncture point. But if you believe in it, because with the acupuncture, they say they can revitalize all the face. I don't know if it is true, but my attitude is always to start from there. It's a very superficial puncture, slow speed.
When you inject in the malar area,
Yeah.
Do you very much restrict patients who have edema here? Do you see that
No.
you increase the edema in that area?
No.
I mean, we know the malar festoon area is a danger area where they can really worsen with injection. So how do you select your patient for that injection?
No, I do not select the patient. I have never edema in this area. I am very, very superficial. The only is to be superficial, but not to create pymphosis. No pymphosis, superficial, and nothing more. And I do not create any pymphosis, only a drop of RHA1.
You used up half of the syringe until now, right?
Yes. My first point is on the tragus, and after I go following an ideal line. Ça va, madame? She has no cream on the face. It's not painful. And usually 3 sessions are enough, 1 per month.
Yes, you mentioned that. Do you see any downtime, Giuseppe? What would be the downtime? Does she have to avoid anything for the next couple of days?
This is a lunchtime treatment. She can go to work or she can go home without any problem. Some redness, that's the worst that you can have. And usually I do a massage in this way from behind the patient, and I put some Teosial post cream to improve the downtown of the patient. And I suggest some cosmetic after. The skin of the face is a little bit red, but in 1 hour she will become normal and no signs, I mean.